Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy,
And my name is Sarah.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi, and welcome to another edition of the Gritty Nurse Podcast. We're so happy we have another guest this week, and this one, another episode for the fire. We're gonna bring the heat again. We're gonna talk about all these tough issues, and you know what? This is actually another topic that's really near and dear to my heart. So, Sarah, could you please introduce our guest?
Absolutely. And because we're all about advocacy, we have a fellow nurse advocate, and her name is
Natalie Stake-Doucet.
She is currently the president of the Quebec Nurses Association and a PhD candidate. She graduated as an RN in 2010 and started her career in a rural hospital. She specialized in mental health and later worked in forensic psychiatry in Montreal before becoming an emergency room nurse. In 2014, she felt the need to further her education and knowledge and started the primary care nurse practitioner master's at McGill University. Following the successful completion of her Master's of Science, she decided to pursue a PhD at the University of Montreal in 2016. And so I'm very excited to welcome you today, Natalie. Thank you so much for joining us here at the Gritty Nurse Podcast.
Awesome. Thank you so much for having me. I'm extremely happy to be here.
So I wonder if we could just start off by you telling us a little bit more about yourself and how you kind of got started with advocacy and the work that you do.
I guess I was kind of born in a family of advocacy or activism, I think is a better word for it. So I think my first protest, I was like 18 months old or something like that.
That's amazing.
My mom grew up in the U.S. and was a big anti-war, anti-Vietnam War, activist and a feminist. And my dad, who grew up here in Quebec, was involved in all kinds of social justice movements in the 60s and 70s. And so my brother and I were both sort of raised in that in a pretty cool household. I mean, it was awesome for me. I remember as a kid going to protest was like my favorite thing ever. There was music and there was people all over, and it was great. So it was always something that sort of came naturally, I guess, because of that. And when you become a nurse, I think at the same time you also become aware of a lot of the issues that face us as nurses. So it felt like a great place to do some more activism, and I just fell right into it. And I think as nurses we have the most awesome job in the world, but we have the worst conditions.
Yeah.
So I think it's a
Yeah.
really important place to do activism, and I'm happy here. This is a good spot for me.
So it sounds like it was in your blood, really, and you grew up with this sort of activism that you could see from both your parents. It was role modeled to you, and that's really awesome that you were able to sort of take that and incorporate it into your own sort of career path.
Yeah, for sure. They definitely raised us like that. So I guess it's really part of our personalities, and it's fun. I'm the child of hippies, so I guess this is what you get from the flower power kids from the 60s.
Well, that's still awesome. I think that this will be a really good episode because talking about advocacy and activism and political activism, for whatever reason, it's like this new thing in nursing. And it's like, no, we should be doing this right from the hop, right? We should be talking about these issues because we're not just involved at the bedside. Like whatever happens in policy affects the way that we deliver care. So why not actually be involved in making some of these changes, making some of these decisions, and then speaking out if things aren't adequate, if things are putting patients at risk and jeopardizing their safety, or even putting ourselves at risk. I think there's a lot of apprehension out there, I would say, in terms of nursing advocacy. But maybe tell me a little bit about your organization and some of the grassroots work that you actually do in advocacy.
Sure, yeah. So I'm the president of the Quebec Nurses Association. It used to be another name, but in 2017 we decided to just call it the Quebec Nurses Association. So it's been around since 2014, more or less, and I've been a member since 2014. And in 2017, I also became president. And we're a group of nurses who really want to change nursing, but also change the world, I guess. We really feel that as nurses, we have a unique perspective on the human condition and how social problems affect the health of the people that we care for. A lot of us on the board are emergency nurses. Almost everyone on the board of directors of the Quebec Nurses Association actually works in the field. So we have a few ER nurses, we have an NP, we have northern nurses. So for us, it's really important to have that, to actually have our hand on the pulse, or even be the pulse, because we really think that all nurses can do political advocacy, can do political work, political activism. You don't need to have necessarily a position to do that, to be a manager, to be, in actual politics. And so that's a really important part of what we do, is showing that nurses, wherever you are, you can actually do something. And it's fun to do, and it's fulfilling to do. And so that's what we've been doing for the past few years.
That's amazing. And
Amazing.
I really like the fact that everybody who's a part of this group are actually grassroots nurses. Like they actually are still practicing. I think that is a hugely important part in terms of having that buy-in from other nurses, right? Like it's so hard to be
Yeah.
like, you're a part of like a nursing union or a nursing foundation, and the nurses are so far removed from the bedside that it's unrelatable. Like it's just like they don't understand what's really happening on the ground where people, are suffering, or they're like, there are challenges here. But the fact that you actually are working still as a nurse and you still hold that position, I think that's
Makes it really hard to
I'd
organize meetings,
imagine.
though. Oh my God.
Oh, I bet. I bet.
Oh man. Yeah, because we have people working nights, evenings, not
Yeah,
everybody's on
yeah,
the
yeah.
same weekend. So, Lord, that's a pain.
Yeah, and it must be a lot for you too, because I mean, you're doing your shifts, you're trying to organize these meetings. You probably want to have them on somewhat of a predictable schedule, but you're not even on a predictable schedule.
Yeah,
So,
no, we're not,
yeah.
especially with the pandemic. All of, I'm the only one that wasn't a nurse at the beginning of the pandemic, but then I went back to help out, and so I was in long-term care at the beginning. Now I'm doing contact tracing phone calls from home, which is makes it a little bit easier on my end. I'm more flexible, but yeah, it's been quite a ride. But at the same time, the amount of work that we've done since the beginning of the pandemic in terms of advocacy is huge. I started collecting newspaper articles, radio interviews, TV interviews, all kinds of stuff that we did since the beginning of the pandemic. And between like April and July, I I gathered like 20 different things that had come up, either in the media, the regular media, or the social media and stuff. And so we've been very, very busy little bees.
Could you maybe tell us a little bit about some of the activism work that you guys have actually done? Because I mean, I
Sure.
think Ontario, we look to Quebec, we're like, what are they doing? What exactly are they doing?
Really?
Because
We
you
do the
guys are
same with you
no,
guys.
you guys are the trailblazers. Every time something happens in Quebec, we're like,
Wow.
what are they doing? We need to be doing the exact same thing. So maybe you could just tell us a little bit about some of the great work that you've been doing out in Quebec.
That is so weird though, because in Quebec we say this exact same thing with Ontario. We keep like, look at the nurses in Ontario, look at what they have, and look, we should be doing that here. So that's hilarious, actually. But I guess the grass is always greener. But yeah,
Right.
so
Yeah.
at the very beginning of the pandemic, just right after there was, the emergency sanitary measures that were implemented, So that started in Quebec, March 13th. We started the first confinement, I guess you'd call it, but the first really serious public health measures kind of started coming into play. And so between March 13th and April 9th, we started, because since a lot of our members are on the ground, we knew that this was going to hit long term care hard,
Yeah.
very, very hard. We were already hearing horrible stories. And so we were like, okay, we got to do something. So we worked to make a sort of coalition with family members, physicians. We even had dentists and just anybody who would join us, other community organizations and stuff like that. And we did a lot of research. We did just a really quick but very thorough, because a lot of us do have experience in research too, so we're able to produce some pretty good documents. And we have access to research because I'm at the university, so I use my access to the library well, or a catalog of magazines. And so we produced a recommendation, so a policy brief basically, that was kind of like a 2-pager that explained the situation, the threat to long-term care, and what we recommended should be done based on the experience of other countries and the knowledge that we had. So that we sent out April 9th. That was our very first sort of attempt to see, to help to push the government to really do some lobbying, I guess you'd call it, to push them to implement measures that would help protect long-term care workers, long-term care residents, their families, and everybody else who is around long-term care. We didn't even get a response, which was really unfortunate. We kept sending it. We sent it to a whole bunch of different deputies, both in the opposition and the government. That didn't work out so well, so we just kept pushing.
Yeah.
We did a whole bunch of other policy notes. We wrote a bunch of articles for the newspapers, editorials, things like that. When I started going in long-term care, I started early April, like April 2nd or something like that. And I wrote a public diary on Facebook every single night. Well, actually, I worked evenings, so the next morning when I woke up, I would write a diary of everything that had happened. I happened to be in the worst hit long-term care at that time.
Oh my goodness.
We had it was horrendous, truly, truly, truly harrowing. But it was very cathartic to be able to write that publicly, and a few of the posts got quite a lot of pull, actually, like thousands of shares and stuff like that.
Wow.
So
Wow. Yeah.
there's actually an artist, an audio visual artist, a really cool artist called Jenny Cartwright. She's making a audio artwork with
Okay.
that, which is I find is really cool. So I was able to really detail stuff like, I remember the minister of health one day, because at work we would all the TVs are open, right? In long-term care you have the common rooms and stuff, so we'd listen to the press conferences. And so I remember one time, at the press conferences, the provincial minister of health saying, no, we don't have any problem with PPE, it's okay. And like 5 minutes later, my coordinator, she comes in and says, we don't have any more blouses.
Oh,
You
Oh
guys
my
are going to have
God.
to make do. You're going to have to either wash them or use the patient gowns, which are, short
yeah.
sleeved. And we didn't even have any more of those.
Oh my
That went
God.
like in a few minutes. So I remember the minister of health had said, if ever you're missing anything, just call me. I'll do so. I was like, fine, I'll call.
Take him up on it.
Bet you regret that.
Yeah. Yeah, so I called from work. I said, my name is Natalie Stake-Doucet. I work in this long-term care, and we are out of PPE. And so the girl on the phone obviously thought I was out of my mind. But it was a question of principle, and I had all my colleagues around me saying, she told us, so let's all,
Yeah, they're all like,
I
call,
was,
call, call.
and they were like, "Are you actually on the phone with them?" I'm like, "Yeah, that's what she said. I'm gonna do it. Take her up on it." And obviously, the girl was like on the phone was like, "No, that's not how you're supposed to proceed. Call your employer." I'm like, "Okay, so who am I supposed to call
Right.
in my employer? Do you know who has the title? Who is in charge of distributing PPE?" And nobody knew. Not a single person knew that I was able to reach, which just sort of helped me realize how the gigantic fusions we had in the last healthcare reform, especially, really make it hard for anybody on the ground to reach anybody in management. It's just unbelievable. I tried to find, who was in charge of different services. I looked on the website of the healthcare authority that I was working for, and a lot of the directors, all they had was their LinkedIn profile. There
Oh
wasn't
Oh
dear.
even
my
an email
goodness.
Oh
or a
no.
phone number or anything like that, you know. So it was horrible. And then one of my colleagues, who a super courageous, extraordinary orderly, she posted a photo of herself wearing garbage bag like the nurses had done in New York City, and she knew she was going to get in trouble for that, but she was like, we need gowns, we can't work, you know. At this point, we didn't have hot zones or cold zones. 80% of our residents were infected. More than half the staff was gone with COVID. We were seeing people die, several people die every single day. It was like horrible. It was post-apocalyptic. It was the worst place I've ever been in my life. um, and so she just posted it online right away. She took her phone out and she took a photo. And as soon as the first journalist wrote under her photo on Facebook, "Can I call you? Give me your phone number. I want to talk about what you're doing." Bam, we got blouses. They
Yeah.
appeared. From where? I don't know, but we had been told we wouldn't get them for another week and a half. And so it took that,
Wow.
and she was threatened afterwards. She was told, "You're going to pay for what you did," and stuff like that. And but she put herself on the line so that we would, because she knew, we all knew we would get them if we would get attention like that, which is again outrageous that that's what we have to do to get the PPE. But it was really also heartening to see how my colleagues were willing to really fight for this. You know, we were all
Yeah.
kind of in the same boat and willing to stick our neck out, because this was literally, life and death every single day.
Yeah.
It was
Yeah.
unbelievable.
I think that's a perfect example of how you were able to advocate for, better working conditions. And I think a lot of nurses in your situation might not have done what you did. But I feel like, just going back to something you said, that all nurses can be political advocate. I feel like a lot of nurses don't see themselves that way. They see politics as something that's totally separate from nursing or from healthcare. So I just wondered, what are your thoughts on that? Like, how can nurses be more political if this is how they feel right now? Like, are there small things that they can do to sort of get started?
Sure. I mean, there's a lot of ways to be political. You know, you don't have to be a member of parliament to be political. You know, that's not, for
Yep.
me, for example, I'm somebody that's extremely political, but that's
Yeah.
not something that attracts me. You know, I've
Right.
worked with different campaigns and stuff like that, but that's not something that I see myself doing, for example. So for me, that's not interesting at all. I find it awesome when a nurse, runs for office, and it's great. And I think we need more of that, but there's so many other ways to be political.
Hmm.
And the first way to be political um, is to have, I guess, first of all, solidarity for me is the most political and most important thing we can have right now in our
Yes.
workplaces.
Yes.
Yeah, no,
You
I
know,
I
to
wholeheartedly agree.
yeah. So get to know your coworkers, work together, and look to see, what's the most pressing issue at work, and see what you can do for that. You know, here it's been in Quebec. I mean, you guys know, but I guess, but Quebec has been terrible for years now, but especially since the beginning of the pandemic, and we've had a lot of sit-in strikes
Yeah.
since the beginning of the pandemic, because of the Ministry of Health decreed that all union collective agreements were not, were suspended for the time of the pandemic. So
Hmm.
all the health authorities are allowed now to apply that whether they have COVID cases or not. And what, obviously, the second that the Ministry of Health decreed the emergency, and that collective agreements could be suspended, well, everybody's just jumped for it. So now, all nurses who were part-time are forced to be full-time. Schedules all over the place. If you had a full-time position, day shift, now you can work nights, evenings.
Yeah.
And we're all willing to do that for a couple weeks, maybe 3 weeks. But it's been a year, and it's especially frustrating for nurses who have to go through that with not a single case of COVID in their hospital, for example.
Right.
This is
Hmm.
supposed to be for an emergency, not for just dealing with staffing issues that we had before the pandemic. We all showed up for the pandemic. We were there. We got sick. In Quebec, as of, I think, June or July, a quarter of everybody who got COVID in Quebec was healthcare workers.
Wow.
So we showed up. And now, we had so-called shortages before. Basically, our health authorities are incapable of retention. That doesn't seem to be a thing. Um, I mean, it's not the same everywhere. Obviously, there are areas that are much doing a lot better than others, but long-term care, especially,
Mhm.
has trouble recruiting and keeping people because the working conditions are absolutely abysmal in a lot of places. So, obviously, if you don't get treated with respect at work, it's going to be hard to want to stay there. you
Yep.
know so a lot of and now with the emergency decree that says, I can make you work anytime I want, as often as I want. There's you know phenomenal quantities of forced overtime. So, nurses go in, they don't know when they're going to get out. That's not compatible with, having a family or having.
No.
And a lot of us feel like the government still thinks somehow we're like nuns still living 24/7 at the hospital who can just,
Yeah.
be deployed whenever. And so, that's one of the things that, a lot of people, as it's been really impressive to see the solidarity among nurses, especially for sit-in strikes, which technically are illegal. But at some point, what are we going to do? Like, nobody has a plan for forced overtime. Nobody has suggested anything. The decree is still going on. We've been trying to send policy briefs to the Ministry of Health, to, health authorities. We've used every single communication channel that we can with, well thought out, researched recommendations that are applicable, short, medium, long term. We've literally done the work that a lot of people up there should be doing, not us on the
Yep.
ground. And, you know, at some point, if you keep ignoring us, we're going to have to take another road. So I think that's what a lot of nurses have done. And good on them, because every single sit-in strike that we've had has led to change immediately, you know?
Yeah.
So,
Hmm.
We sit in all of these various different Facebook groups where there are like, I think one Facebook group we're in, there's over 20,000 K nurses, and we read all of the complaints and problems and all these things that they're saying, but like, to mobilize that movement. But it's like almost virtually impossible here. People are so afraid to speak to the media. They're afraid that they're going to get fired or from reprisal.
oh, here
Like,
too, God.
but it's just like, if we don't say anything and we don't do anything, we're going to be
Mm,
stuck being treated the way that we are. And people don't necessarily know how bad it actually is. Like, we're trying to say, hey, like, I remember when I first saw that picture that you were mentioning, with the picture wearing the garbage
hmm
bags, and I was just like, what the F is
It was
going
actually
on?
two orderlies, just to give a shout out to our colleagues.
Two orderlies. I mean, I was
Yeah.
kind of like, what is going on? Like, why is this happening? And I did see the pictures of the nurses in the States wearing garbage bags too. And I was just like,
Mm,
why does it come to this? And why is it that we as nurses have to be putting our lives on the line, putting ourselves at risk,
yep.
because people won't hear us or people won't understand that, when we're saying we need PPE now, it's not we need it a week from now. We need it now because we don't have it. And that means if we don't have it, we can't protect ourselves. We can't then go home
Yeah.
and feel safe to be around our loved ones, because,
Mm,
you know, I don't want to give COVID-19 to my family. Like,
yep.
it's just the fact that you had to go to those types of lengths is just, it's beyond me. It's so frustrating.
Yep. At the same time, it shows the resourcefulness of nurses and healthcare workers in general. Like, I remember another time, before I got rehired to work in long term care. It took a while anyway. So I worked with this group called Give Protection, and it was all our colleagues, mostly dentists, who had had their cabinets closed.
Right.
And so the provincial government was asking for donations of PPE because we didn't have enough stockpiled to last us through. But all these colleagues of ours who were dentists or pharmacists, a lot of pharmacy students too that were taking stuff from the schools, they weren't big enough donations for the government to be interested in them. So they said, well, let's just, we know people, so let's see where do they need PPE, and we'll just go bring it to them. And I was part of that for a while. I remember doing bike runs, with like big bags of
Wow.
masks and N95s. I brought some to, supervised injection sites who got, looked over very quickly
Wow.
in
Yeah.
terms of the PPE that they got and stuff. And one time when I started working in long term care, we didn't, I spoke to one of my colleagues. She had been wearing the same N95 for 2 weeks, and
Oh
I
my God.
jumped out of my skin.
Shameful.
I was so angry. And because they wouldn't let us take N95s, they had to really beg and say, like, I really think this is important. We need the N95. This was a full on hot zone, lots
Yeah.
of people dying, high viral loads and stuff like that. And everybody was getting sick. So anyway, so I phoned them and they brought us, two big boxes of N95s and like, blouses and gloves and stuff, and they just showed up. So we sort of have this network of solidarity that was built up, that was able to sort of bypass the formal structures of our healthcare system, who are absolutely incapable of reacting rapidly. So because of the grit
Yes.
of healthcare workers, nurses, dentists, orderlies, we were able to, excuse my language, but we got shit done.
Yeah.
When our government was taking too long, when a million committees
Mhm.
or steps in the administration, who you don't know who you're supposed to talk to, were like, no, we need this now, can you help us get it? And we worked together, and that's what we did. And for me, that's the most beautiful thing to come out of that, because no matter how harrowing it was, and no matter how traumatized we're going to be, and we are coming out of this, hopefully coming out of it soon, with the vaccination. But I think it showed us the true face of healthcare. It's
Hmm.
us, and we're the ones that are really carrying it on our shoulders, literally. And in a time of a pandemic, experts have been predicting this for years, that we were going to have a pandemic. It's not surprising, because of the destruction of the environment and stuff like that. We're much more exposed to viruses that we shouldn't normally. So, it'll probably happen again, but our healthcare systems are supposed to be able to respond to things like that. And the slowness, because of the bulkiness of our healthcare system, everything's super centralized into the hands of, a few people picked by the Minister of Health. That doesn't work for an emergency like that. And
Right.
thank goodness we have the quality of healthcare workers that we have, because, despite the horrors that happened, it could have been even worse. We're up to
Yeah.
10,000 deaths in Quebec now. Just in the long-term care place where I worked, half the residents died.
Oh
You
my
know,
God.
it was,
What a
it
tragedy.
was, yeah, it was fucking traumatizing. Like,
Yeah.
I'd never seen, as a nurse, I'd seen people die before, but never
Not like
this
that.
way,
Yeah.
and not the volume, like the volume of people. It was just, and alone, and it was just sort of mind blowing. It's like, it's like an alternate reality, and then you go home and you have all these people who, and you look at the news and you're like, is this, am I going through a portal or something like that to another
Yeah.
dimension when I go into work? How can, and this is just mine. Half the residents died. That's why I stopped working there, because there weren't enough residents anymore to,
Oh my
justify
God.
the amount of staff, and you're like, and it's just this one long-term care place should be a freaking scandal, and there was so many across the province where it was the exact same thing, and it was very hard on morale. And I was only there for a month. I can't even imagine what
Jeez.
my colleagues are going through after a year, but long-term care especially, always sort of looked over.
Yeah.
We're like the poor cousin that nobody ever wants to give us anything, and yet we're so important.
I wholeheartedly agree. And I mean, I really don't know how people are going to bounce back from what they've seen, right? Like, I think it's just the sheer magnitude. Like, yeah, like you said, we've dealt with death. Myself and Sarah have dealt with like neonatal death, and I think we've had like the rare occasion of like a maternal death, and that's devastating. But the fact of the matter is a death. Like, seeing that magnitude, I don't know. Like, this is where we keep on advocating for making sure that we do have those mental health resources set up for healthcare professionals,
Yep.
because the fallout of this, like, I mean, when they talk about PTSD, I think people think it's like, oh, it's an immediate thing. No, this is something that will follow people, healthcare workers, for a long time, and it'll
Forever.
manifest in a variety of different
Mhm.
ways. And it's
Mhm.
just, we
Yeah.
need to really start thinking about
Yep.
what are our next steps.
Absolutely. And I think you don't realize it. And I think a lot of us really need to understand that. And I was lucky because my husband is super supportive. He was there the whole
Hmm.
time, and, waiting for me at night when I got home, um, so I could bawl my eyes out, and just sort
Yeah.
of
Oh.
curl up in a fetal position, and just like, and he'd just stroke my hair and say, it's over, it's over, it's okay,
Oh
it's
my
okay.
God.
Oh, yeah.
And, it wasn't every night, but, it was hard enough. And at one point, I stopped the first time because I got sick, because I got COVID, and then he got it.
Oh no.
And yeah, that sucked too, because then you live with guilt. You're like, God, and we had talked about it before, so we had sort of, he knew the risks, and we had discussed, should we stay apart, should I stay at a hotel, or should we stay together, and he's like, no, if we're doing this, we're doing
Do
this
it
together. So
together. Yeah.
that was awesome, and I couldn't have gone through it the same way. But you sort of, he's the one that noticed that my personality had changed a little bit. I
Yeah.
was,
Hmm.
maybe a little bit more irritable, maybe a little bit more prone to open a beer, quickly in the evening and stuff like that. And just stuff that I always like to have a good time, but this was different. So I
Yeah.
was lucky. I was
Yeah.
able to get a little bit of help through a study, like a research study. They were studying burnout and PTSD and anxiety disorders with healthcare workers who had gone through long-term care. So I was able to get through 2, anonymous sessions with a psychoeducator, and she was amazing. She really sort of helped put that in
Hmm.
perspective and say, talk about the guilt and the questions and the doubts and everything around that, and sort of the blocking it out. And as nurses, we're really good in doing that, sort of,
Mhm. Mhm.
because we're sort of
Hmm.
brainwashed into being stoic. And
Yeah.
so,
Nope.
if you're able to handle it, then you're a good nurse. But and that's sort of reflex that we have. But even if we don't process it and just repress it, it's still going to show up, but in different ways. And
Oh,
Absolutely.
so that's
absolutely.
that's
Yeah.
how we don't usually realize. They're like, well, I'm not crying, I'm okay. But just because you're not crying doesn't mean it's not affecting your life in a lot of different ways. How are you eating? How are you, what's your consumption of, substances? Has
No,
it
no, I
changed?
hear you.
What's your, yeah, how are you dealing with your kids, with your family and stuff like that? And it's in little things like that that you sort of realize, slowly but surely, that okay, yeah, this has affected me more than I thought it would. But you need people around you to be able to tell you that. You can't, it's not something you're like, oh, I'm sick. And that's what kind of
Hmm.
drives me nuts with the mental health, ads and stuff. Like, if you need it, get help. You don't know that you need it
Right,
when
right.
you're
Yeah.
really not feeling well. You need
Yeah. Yeah.
help. You need somebody to be there and say, hey, I think there's something wrong, maybe you should get help. And if you don't have that, we need psychologists, we need social workers at work right now in the places
Oh
that
my
we're
god,
hardest hit,
yes.
to help
Yeah,
us.
I totally agree. I know. I think this is something Amy and I have talked a lot about is just the mental health support, right? Because not only is it not it's not something that we like to ask for help, right? There's a lot of shame, a lot of guilt associated with it, but it's like even if you find the energy to reach out for help, it's not there a lot of times. So you're scrambling, like you're
Exactly.
drowning. And I've kind of thought about this like when you're drowning, sometimes you can't even take a breath to ask for help. So you do need people that are going to
Hmm.
proactively seek out, like ask you if you're okay. It can't be just, like you said, call me or email if you have an issue, and then you're set up with someone that maybe isn't a mental health professional, but they're there just to talk to you. And one of the things that Amy and I are advocating for is better mental health supports. I don't know what they're like in Quebec, but in Ontario, a lot of times our benefits might cover one treatment or one appointment. And as you know, that is just scratching the surface about what you might really need
Yeah.
to work through.
Not enough.
Yeah, and like even when you were describing all the deaths that you saw, I can imagine that maybe at some point you would just be desensitized to all of it, or maybe you just pack up your feelings into a box and you move on to the next patient and you don't really deal with the situation and the emotional baggage that goes with all of that.
Yeah, I remember one time one of my colleagues, and they were the best, man. Honestly, we were going through really, really hard stuff, and they were just extraordinary human beings. I will never forget them, even though I only worked 1 month there. It was like, they will forever be in my heart. And I still talk to them, every now and then through Facebook and stuff like that. But you're sort of dragged, you go through hell, and it changes your, I think you can build some very deep relationships with people in a short period of time when you're going through something that intense.
Yeah.
You need people around you to notice you, and that's how you realize that you need help and you can get help. And I remember, I have some friends, a lot of nurses, most of my friends are in the healthcare system, right? When
Right.
we work nights and evenings and stuff like that, that's only the only people you can hang out with, right? um, but one of my friends who's a social worker, just in terms of the services in mental health right now, it's just, I mean, it was bad before the pandemic, but it's even worse now because they've been sending psychologists, social workers, sexologists to work as orderlies in long-term care.
Oh
or
my
in
gosh.
COVID
Wow.
hit hospitals, and that has already, as if things weren't messed up enough. But a lot of my colleagues, like one of my social work colleagues, she's like, I don't know how to feed someone. What if they choke, and she's terrified. She's never gotten that training. That's not what she's there to do.
Right.
And they're
Right.
just
Whoa.
throwing her in there. And they're just throwing anybody. I remember the prime minister of Quebec said they were going to send physicians, and he said on national TV something along the lines, but don't worry, we would never ask you physicians to do the job of an orderly. You guys will do the job of nurses, and then the nurses will do the orderly's job with the orderlies.
Oh my god.
And I was like, excuse me? Are you kidding me? Is that a joke? And I remember in long term care, because we were one of the hardest hit. So we got a lot of I was working with two specialist physicians, lovely people, super hardworking, uh, lovely people, one ophthalmologist and one radiologist. And they don't know how to feed somebody,
I was
how to
gonna
give
say
meds. Like,
those are
come
like the
on.
worst two to ever come in to do
No, they were
healthcare.
great.
It's
Like,
like
they,
what?
whenever I needed a prescription for something, for end of life care, for scopolamine or whatever,
Sure.
they were
Okay.
there. They were like, we want to help as much as we can. And I'm like, okay, but this is, they would help me give out meds, but it was,
Oh my
that the
god.
prime minister would say something like that on national TV, and, as if somehow, you have like physicians that can do everything, then nurses that can do what nurses can do, and orderlies can do, and then orderlies. That's not how it works, the naivete or the misconceptions around what nurses do, what everybody in healthcare does, is so profound in our society, that
Yes.
this for us, I think the pandemic, we've really tried at the Quebec Nurses Association, at least, and a lot of my buddies, we've really tried to sort of bring that to the fore of what we actually do and how, essential we are. That is, we're not just peons that you can move around,
Right.
and say, oh, well, let's put a social worker here, a nurse there, and it's not that's not going to make care any better. It's not, you're not fixing anything by doing that. And so I think slowly we've had an impact, not a huge impact maybe on society, but I think for me the most important impact is on nurses themselves, because I want
Mhm.
nurses to see themselves as, I want us to see our worth collectively as nurses, so that we can collectively, say F you to the
Yes.
forces that be that try to keep us down, and say, no, I know what I'm worth. You can't put me down. I can say whatever I want to the media, because I have a professional clinical judgment that I can use to say this measure is dangerous for myself and for my patients. And
Right, right.
my training and my education allows me to have the intelligence to say that, and so I think a lot of nurses are terrified of speaking in the media or speaking publicly, because they say, oh, it's going to be misconstrued, or I could get professional problems and all that stuff. And there's so many, there's so many things we like to tell ourselves that could go wrong,
Mhm.
and while there is a risk, I think we also have to see it as a responsibility, and also see the incredible value that our professional opinion has as nurses in the public arena when discussing issues like long term care, like pandemic, like PPE. It is essential that we speak out, because
Mm.
if we don't speak out, there's a giant piece of information that's missing. And no decision maker is going to be able to take a proper decision if he or she doesn't have
That
our
information.
point of view. If there's not a nursing voice in the mix, um, it's just going to be the wrong decision. It's nobody's fault. It's just we need to be there.
I'm so glad you said that because I feel the same way. There's this huge culture of fear and silencing with nursing, and we need more role models to be saying, hey, it's okay to go to the media. It's okay to speak up. And I think the more that we do it, the more people will follow in our footsteps. So I'm so glad that you're doing this here in Quebec. Amy and I are doing this here in Ontario. I'm hoping more people will join us. I
You
think
guys are awesome.
slowly they are, but it's not like we did our interview with the media and the world ended the next day. We're still here. I think we've done
Right.
maybe 10
Yeah,
or 15
exactly.
now, and it actually gets easier with practice. And a lot of times they do ask the same kind of questions, and so we're getting better at it, and it's just about having that voice and that advocacy and knowing what you're worth, like you said. That makes all the difference.
Yep. And having the courage to take the first step. Like you guys,
Yes.
the first time you did it, the first time I did it, it was far from perfect. I've had some horrible experiences with the media, but I'm still here. I didn't have
Right.
to move to another country. I didn't get fired. I mean, there are risks, but we have to trust ourselves and, stick to the message, and we can do this. We really can. It is possible. If I can do it, if you guys can do it, we could be a force of nature, you know.
I
Yeah.
agree.
And once you realize that, you're like, oh, if only we could harness the power of nurses. And if we all spoke out, we'd be unstoppable. And I really honestly think we could not just change healthcare, but change the world.
No, I wholeheartedly agree. I keep on saying, I'm like, they're like across the world, 20 million nurses. I was like we
Yep.
should be informing so much of some of the healthcare decisions, because
Mm.
we are we are researchers, we are theorists, we are like, there's so many different aspects that we have to bring in a different perspective and a different opinion, that we just need to let people know what our worth is. And I have a last question, and at first it was kind of funnily phrased. I was going to say, why should nurses be political advocates? But I'm going to change it. How can we encourage more nurses to be political?
Well, I think as, like what you two are doing, what we're trying to do, I think is really to, because there's a lot of, I think we're sort of educated and sort of socialized into fearfulness and in some ways deference to the powers that be. Nursing has, since basically the Nightingale reform of the Victorian era, has been madly in love with hierarchies.
Right.
We love
Hmm.
our
Mhm.
hierarchies in nursing and hospitals, and so whatever the boss says has to go. And so we've sort of been ingrained in that for over a century. Nursing has really, adopted that sort of top-down, very militaristic type of functioning, which has a huge impact on our healthcare system. And I think at one point, sort of realizing that that's not necessarily the best way to function in healthcare. This is not the military. This is healthcare, where different things happen all the time. We need to be flexible. We need to trust ourselves and our colleagues. Um, and so I think really sort of approaching our colleagues to make them see how amazing they are. Like
Hmm.
that's how I try to go, because we hear so many times like, oh, nurses aren't, they're always bullying each other, they're always doing this and that and blah blah, and we can't mobilize them. And it's true, it's hard, but that's society in general. It's hard to mobilize large groups of people rapidly.
Right.
But
Right.
I think, really sort of working with my colleagues and you know looking at how they work and noticing like, hey, that was amazing what you did, and how about we do this? And so sort of really working towards not um, being genuine, for one, because I think a lot of times when we do see, some nurses on the radio or TV or in the media, they have a certain social standing, so they're either president of something, or or some
Right.
kind of, and so a lot of times the message might not necessarily resonate with nurses who are on the ground all the time.
Hmm.
Mhm. Mhm.
So for me, and that's why it's so important for us at the Quebec Nurses Association to keep our board, people, nurses who, to have a good mix. So, we're happy to have managers and researchers, but we want nurses on the ground as well, who are
Right.
involved in direct patient care, because we need that mix. And we want to have an organization where whether you're a nurse manager or researcher or a floor nurse, you're all equal.
Right.
There is no hierarchy there. And so we're trying to sort of model what we think should be the way nurses collaborate with each other, and how we should have each other's back, and how we should just raise each other up. Like I keep thinking about, there was this meme going around a while back, about how it's important to have female friends, and it was just this poor girl who was just like eating ice cream or whatever. I can't remember. She's like, oh, this is horrible, blah, blah. And then all her girlfriends come and just raise her up, and they're holding her up like, you're a goddess, you're beautiful, you're perfect, you're this and that, kind of thing. And I found that so uplifting, such a cute but nice thing. And well, obviously, we have to be clear on principles and, respect and things like that. I think the hierarchies we have should not exist. I think they're not useful any way. There's something, the hierarchies in hospitals and nursing are something out of another era,
Yeah.
and that should be in the history books or in museums, not in actual current healthcare.
I agree. Let's blow the dust off of that.
Yeah. But we're so afraid of debate and polarization in nursing, and
Mhm.
I come from a family of people who debate all the time. We argue all the
I can
time, but
see that.
we still love each other.
Right.
It's so, I was never afraid to argue in nursing, and people would look at me like, what the hell are you doing? That's the teacher, or that's this. I'm like, well, I want to know about, or I'm questioning this or that, and it's gotten me in trouble a lot of times, but again, I'm still here.
Right.
And so
Mhm.
we have to stop being afraid of questioning authority, or question, if you
Yes.
have a valid
Yes.
question, ask it. What's the worst that can happen? And sometimes you do get in trouble, but most of the time, if it is trouble, it's temporary. And
Right.
I think you gain a lot more than you lose, when you trust yourself enough to question authority, especially if you think it's wrong. If your healthcare manager comes in and say, oh, instead of having 6 patients today, you're going to have 8. Is that safe? Ask yourself, is that safe? Were any nurses consulted in this decision? And stuff like that happens all the time. An engineer would never get told by a boss like, okay, we can't use steel, you're going to use popsicle sticks now.
Right.
Nobody would ever say that, but that's basically what they're telling us. I
Right.
remember working in long-term care once a long time ago, but I had 178 patients. That is basically the same thing as asking an engineer to build a bridge out of popsicle sticks. It's not going to
Right.
work. You cannot give proper care in that kind of situation. So at
Yeah.
some point we have to just say, this is not acceptable, and we're healthcare professionals, and if we have a responsibility to our patients, I think we've really showed up in this pandemic, but our employers have a responsibility to us and to our patients as well. So
Yes.
I feel like there's been so much responsibilities, we've been shouldering so much, that load needs to be shared. I'm willing to step up, but if my employer is not going to do the same thing for me, at some point, something's going to give. And so, whether it's forced overtime or anything like that, I'm going to do what I need to do, my professional responsibilities, but I expect and I demand that my employer recognize me as a human being, my rights, and that he do his job too. If we all do our
Mhm.
job, we're going to be good. But it's okay to call it out when you see it, when somebody's not uh, doing their job properly, or doing something, or as an organization they're doing stuff that might put you or your patients in danger. And
Yeah.
it sucks, but we got to do it, and we can do it.
Yeah, no, I agree with you. And I feel like my whole situation, like with Gritty Nurse podcast, with advocacy, it's like, what am I doing if I'm not gonna call out something that's unsafe? What am I gonna do if like I just feel within my own self, if this is true and this is actually happening, how can I keep that to myself? If I know someone out there is going to be harmed, or there's harm that may come that in that person's way, especially, we say that we're patient safety advocates. If we are seeing something that's untoward, how can we not say something? How can we hold that in? And I feel that if
Mm,
it comes from a place of genuineness, it comes from a place of trustworthiness, truthfulness, then we shouldn't be afraid of getting in trouble, because if we are sharing the truth with you, I think there are way worse things that can happen as opposed to telling the truth and bringing
yeah.
something to light. Like, I think it's just, I can't sit with the knowledge of knowing something is untoward and just
Mm,
turn a blind eye. I think I just can't.
absolutely. And there's different ways to do it. You can go talk to your
Absolutely.
union rep, and you can go talk to your nurse manager if she's somebody you can really talk to. They just use whatever's at your disposal, and just keep at it. And it takes a while, and depends on where you're working. Some places are really open, some places are not.
Yes.
And the media shouldn't be something that scares you in that context. You should
Yeah.
try to
Absolutely.
get it done at work, but if it doesn't work, by all means, contact journalists. They love that kind of stuff. So why
Seriously.
not?
No, I'm just so inspired by everything that you have done. I have really enjoyed a lot of your stories.
Yay!
I think there's a lot that our listeners could get out of this, and I just think you're a great example of what we should all aspire to be. And I'm excited for the work that is yet to come with yourself and the Quebec Nurses Association. So
Awesome.
thank
Well,
you
right
so
back
much.
at you. I'm so honored to be on your podcast. Let's normalize troublemaking.
Yes.
It's all good.
Yes, new
It's
hashtag.
You know what?
okay.
It's
Yeah.
okay to get into some good trouble. I'm here
Indeed.
for it all day.
Yeah.
Give me that good trouble. As long as I'm
Yeah.
making sure that I'm keeping my patients at the forefront and they're the ones that I'm wanting to see change for, I'm all for good trouble.
Yep.
Sign me up.
Yay!